Good afternoon. Thank you for joining me for Haselwood Auto Group's Advantages of Aetna Whole Health. This is a short webinar to cover the many advantages of participating in a medical plan with the Aetna Whole Health Network. Over the 4 medical plans you have to choose from, Haselwood offers 2 different medical networks. This gives you the ability to choose the plan and the network that best fits your family, both for the plan design and the price point. The first network is the Aetna Whole Health Network. This is a narrower network. You have a smaller group of providers to choose from, but plans have a lower negotiated rates for their providers for in-network services, and this means your out-of-pocket costs are ultimately less. Now the Open Choice PPO network, that is a much larger network of providers. You have much more choice. The plans have negotiated costs for in-network services that are higher, which translates to higher out-of-pocket costs for you and your family. The Aetna Whole Health Network is a Puget Sound network, very specific to that area, which is why it's a much narrower network. It includes 3 high-performing, high-quality healthcare provider organizations, all of which are likely very familiar to you. They have the common goal of delivering streamlined, patient-centered outcomes and experience for members. The providers focus on proactive treatment for their patients. They focus on the ease of access to high-quality doctors and facilities, and streamline care for coordination for high-risk populations. The Aetna Whole Health Network provides 99% of all enrolled employees with easy access to primary care providers within 10 miles of their home address. Over 1,200 primary care physicians and almost 10,000 specialists, 16 hospitals, and 60 urgent care centers. Below is a list of many of the local providers, many familiar names that you've seen in and around the Puget Sound area. Now, an important part of choosing your medical plan is also going to be choosing your network. So you've got great plans to choose from, and you've got 2 very different medical networks to choose from. Your Aetna Whole Health Network, that's going to be a great choice if you are already using Virginia Mason Franciscan Health providers or other providers that are already in that narrow network. It's a great option if you have no major medical diagnoses requiring specialist care from outside of this narrow network. If you're interested in that personalized care model, that specialized approach, and if you're looking for lower costs for care and lower insurance costs. Now the second network alternative, the Open Choice PPO network or the POS2 network, this is going to be a better choice if you're using providers that are outside of the Aetna Whole Health narrow network. Also, if you have a major diagnosis requiring specialists where you have to travel for care, this is going to be your better option. This includes the widest network for providers, gives you the most choice, but it does come with higher monthly insurance costs. So you've got great plans to choose from and 2 great networks, but you need to take a look at them and decide which will fit for you and your family and will be the best option for you. So I hope this little webinar was helpful to you, had a lot of information, but I hope that it does help you make your medical plan choices. So thank you for listening and have a wonderful day.